Member for Blair.
Thank you, Deputy Speaker. I'm pleased to speak on the Australian Centre for Disease Control Bill and the consequential amendments and transitional bill accompanying it. These bills deliver on a key Albanese Labor government election commitment to establish an independent Australian Centre for Disease Control and responds to recommendations from the COVID-19 response inquiry report released in October 2024. That landmark inquiry was established by our government in September 2023 to consider the Commonwealth's responses to the pandemic, including vaccination and financial support. And this is because we thought it was important to be transparent about the response from a Commonwealth point of view to COVID-19 and how we managed it and the lessons we can learn to inform better management of future public health emergencies. Now, that inquiry found that Australia was one of the most successful nations in its pandemic response, but as a country, our preparedness left a lot to be desired. Now, I can recall back in the 1980s that people were talking about an Australian Centre for Disease Control in response to HIV and AIDS, and I'm pleased to see this legislation before the chamber today. It's taken a while, but I think it's a matter of good public policy and a matter of necessity. And that's why it's so puzzling that those opposite are opposed to this, Deputy Speaker. I mean, we've seen them rail against tertiary education. They don't like TAFE, the way they go on. They think we shouldn't be giving free TAFE. They don't like funding properly the university sector. The arts seem something that they think is an optional extra. Climate science seems like something that they don't believe in. Now it seems they're at risk of health science being something they deny. Its efficacy and effectiveness. They don't like medical research, and they don't seem to support the idea that we should prepare ourselves. And this was a once in 100 experience that we had with COVID-19. But those opposite also, when I listened to their speeches relating to this bill, seemed to forget that they were in government at the time and that the National Cabinet was something that was initiated by Prime Minister Scott Morrison. Now, I think they also seem to forget that when the colonies formed a federation in 1901, that premiers were powerful, that the states were still powerful. And we might have had some changes with respect to the financial capacities between the Commonwealth and state on income tax, and I'm not going to go through the High Court decisions there. And we might have seen cooperative federalism, and we might have seen the Commonwealth government having greater powers through High Court decisions. Sometimes High Court decisions frustrated Labor governments. Ben Chifley could talk all about that. But when it came to issues of the Constitution, it is very specific about the Commonwealth's power under Section 51 of the Constitution. And the states have primary responsibility for the delivery of public health services through hospitals and in control of their state borders. Now, I don't want to sound like Gough Whitlam talking about rail gauges, but the state governments have enormous power, and this was a reminder during the pandemic of the power of the premiers. But those opposite seem to think there were no LNP or Liberal and National Party premiers dealing with a Liberal Prime Minister. Now, they have criticised us during their speeches on this bill on transparency and accountability. It's a bit galling, Deputy Speaker, from those who brought us robo-debt and a Prime Minister that actually put himself into multiple ministerial portfolios, and they criticised us in relation to gaggish. They're the party that gagged nearly every charitable organisation that could possibly fund. If you weren't gagged and didn't sign up, you couldn't get funding. That's what Prime Ministers Abbott and Turnbull and Morrison presided over. So we had lectures during this debate about all those issues as if they've got some sort of political amnesia, Deputy Speaker, as if they never formed government from 2013 to 2022. So we've got a bill before the chamber today that those opposite claim they're not going to support. And that denialism, which seems so evident in their thinking, in their fractured factional thinking, with Liberal against Liberal, National against National, Liberal against National, which seems so obvious. It's there in the speeches we've heard in this chamber yesterday and today. This legislation is absolutely good public policy and deserves to be supported by everyone in this chamber. Now, the crossbenchers have some amendments that they want to bring in, and that's their province and that's their right to do that as parliamentarians, to bring that legislation and amendments forward. But those opposite have railed against this legislation here. They took a policy to the last election opposing this legislation, and it's as if the consequences of that election had no impact on their thinking, not just on climate, but on disease control and management. It's as if they completely forgot about what happened in May 2025, because they must have thought they weren't in power before May 2022. So this legislation is absolutely vital, and we must do better if we're faced with a pandemic in the future. I want to say, Deputy Speaker, that the doctors, the nurses, the paramedics, the aged care workers, the teachers, the couriers, the truck drivers, the logistic workers who I met during the pandemic in my community in Blair in south-east Queensland are heroes. The council workers who did so much great work during that time. The retail workers who suffered such shocking abuse by people who misbehaved terribly in places like Woolworths and Drake's and Coles, etc. They're the heroes of the pandemic as well, and we should honour them and thank them for what they did. They got us through. It was a tough time. In aged care, anyone who's had a loved one or a friend die and denied the opportunity or had a limited opportunity on the funeral, anyone who was denied the opportunity to go to a family or a friend's wedding, and the challenges we faced that as a family as well. Thousands of Australians lost their lives, while many had their livelihoods severely impacted. I know businesses, workers, community groups in my electorate profoundly affected. Let me give you one example. JBS, the meatworks in my electorate, the biggest private employer in the Ipswich region, experienced a perfect storm on COVID. Market conditions, compounded by the Chinese government's beef import ban, widely seen as a retaliation for former Prime Minister Morrison's call for an investigation internationally into COVID. And as a result, the plant had to cut back from 2 shifts to 1. 600 jobs, member, were lost because of your side of politics. 600 jobs, 600 people lost their jobs in my local communities. So don't give us this nonsense about how wonderful Prime Minister Morrison was. 600 people in my community lost their jobs. Now, to add insult to injury, the Morrison government refused to allow JBS meat workers to access JobKeeper wage subsidies, a devastating blow for the workers. When I asked a question of Prime Minister Morrison in question time, he said they can go and get JobSeeker. They couldn't keep their jobs. So that's the failure of those opposite. It was an awful time for people, and it's a real time. Borders were closed. Australians were asked to stay in their homes, quarantining at home or a hotel when they went across state and territory borders. We all went through it. Unless you're an ACT MP or senator, we all had to do that at some stage. Anzac Day services, which are so important for Australians, we celebrated in a moment of remembrance outside in our driveways. The inquiry found the economic response to the pandemic was critical to achieving the desired public health outcomes. Mistakes were made. There was frustrations and inconsistencies. We know that. People experienced it. We know as parliamentarians that happened for all of us. Modelling cited in the report I referred to said peak inflation could have been reduced by at least 2% if the economic policy settings during the pandemic had better matched the public health restrictions. Global supply stocks contributed to a substantial increase in inflationary pressures in our economy and still have an impact on it. The impact was compounded by poor policy choices from the Morrison government. Now, the inquiry report and the progress we made a proof of our economic responsible management of this government. We focused on fighting inflation, delivering responsible economic cost of living relief and fixing the budgetary health problems. But we know a key finding of the inquiry that Australia went into the pandemic with no playbook, badly stretched health and aged care systems, no clear national management plan, deficiencies in the national medical stockpile. And can I say, as a Labor politician, I really felt from time to time, rightly or wrongly, that there was some politicisation when it came to the distribution of vaccinations. That's how I felt from time to time. The review showed gaps in data and data sharing between the Commonwealth and state, as well as a fragmented, outdated planning and preparation for health emergencies. Shockingly, when we came to government, we were the only country without a CDC equivalent in the OECD. Now, even more shocking was the fact the former government had not led a national pandemic drill for 12 years. We were hopelessly and woefully underprepared for the COVID pandemic. Our response was confused and slow and lacked authority. And I might add, as I said before, the Morrison government botched the rollout of the vaccinations. The inquiry warned we mustn't let this ever happen again. Infectious disease outbreaks, AMR, climate change, changing geopolitical tensions and other things have all impacted on our national health security, and they all demand a permanent national public health authority right now. Hence, one of the central recommendations of the independent COVID inquiry, which those opposite are ignoring, again, is a new Australian Centre for Disease Control. It's exactly what this legislation is doing. Back in October 2020, in opposition, we committed ourselves to a transparent, trusted and independent CDC, consistent with the outcome of the inquiry. We came to government. We established an interim Australian CDC in January 2023 to immediately improve the way we prepare for and respond to health emergencies. It's almost like those opposite didn't know that when they listened to what they had to say. As if somehow this legislation, nothing happened when we got to government except this legislation. We've established an interim CDC within the Health Department. In October last year, we announced that we would invest $251.7 million to deliver the CDC over 4 years to 2027-2028. On top of that, we've committed $73.3 million in ongoing funding from 2028-29 to enable the ongoing operation of the centre. And this bill, and the transition and consequential bill with it, delivers an independent statutory agency that together will bring critical information experts to protect Australia from diseases and other public health threats. And those opposite today, when given the opportunity, will vote against it. The Australian CDC will provide high-quality analysis and advice on public health risks to government and the Australian community, and it streamlines our public health data sharing and linkages across the Commonwealth, state and territory governments. Australians deserve public health data and insights and advice that's high quality, nationally consistent and responsive, not just a crisis every day, and not just a crisis when it happens on a Liberal Party watch. It should be under a Labor Party government as well. The new centre promotes coordinated action to prepare for and respond to public health risks, as if the National Cabinet that the Morrison government presided over, that Prime Minister Morrison presided over, was all about that. And those opposite now seem to have forgotten it and don't want that National Cabinet approach. A transparent, trusted and independent CDC will, I think, strengthen our public capacity to respond, improve our preparedness, safeguard the health and well-being of all Australians. We're safeguarded in many ways by that green Medicare card and by a public health system at a state and territory level that we fund, and the federal government puts a 4 in front of the amount of money we give in terms of percentage to the states and territories. But we can do better, and the missing link in our preparedness and prevention is the CDC. And today we've got an opportunity to vote for it, and those opposite are going to vote against it.